10 years ago, Peter Hansen's stepdaughter gave him an ultimatum. Stop smoking cigarettes if you want to be around your grandchild.
That was his real turning point of going, okay, I'm gonna ring the Quick Line and get some help and make a change, because he desperately wanted to hold this baby.
Peter saw a doctor from a telehealth company called Quick Clinics and switched to vaping. He began importing these Liberty Flights products through a third-party website.
This vaping thing that he was using, it seemed to be better for him. He said to me, it won't harm anyone around me, it won't harm anyone.
Vaping use is surging with 500,000 regular users. Health authorities are concerned and have limited access. Doctors prescribe nicotine vaping products even though they haven't been approved as safe to use in Australia, and the patient either imports them or gets them from a pharmacy.
I think there are huge concerns about vaping and electronic cigarettes when people are exposing their lungs to these dangerous electronic smoking devices.
Look, I've seen many hundreds of smokers who've switched to vaping. It's not successful for everyone, but there are many smokers who have made the switch and quit smoking who hadn't been able to quit with other methods.
In October last year at the Whitsunday holiday resort Peter runs with his wife Pam, he was finding it hard to breathe, and an ambulance rushed him to a local hospital before he was transferred to Mackay Base Hospital.
It's quite a striking scene, clearly in severe distress, taking huge gasps of air, had that real air hunger and distress.
Inside the intensive care unit, Dr McManus and medical staff worked to relieve that distress and investigate what was wrong.
It was clear that he needed to be put in what we call an induced coma and put on a ventilator or a breathing machine for his own relief, really.
Just to see him hooked up to those machines, it was pretty sad.
They've just made a little video.
On his 71st birthday, his family comforted Peter and played him a video from his grandkids.
Happy birthday to you.
I think he could hear it. He couldn't open his eyes.
Oh, they're blowing out the candles.
I just saw these quite huge cystic lesions in the apex of his lung.
Dr McManus suspected Peter could have a new lung condition caused by a decade of vaping called EVALI. First reported in the United States, the term stands for e-cigarette or vaping product use associated lung injury.
I've seen lots of results of smoking-related lung injury. We call that emphysema or chronic obstructive pulmonary disease. There's a few terms for it, but it's generally sort of much more even throughout the lungs. Peter was the first older patient that had had a significant history of e-cigarettes.
He showed us Peter's lungs from the CT scan, and he said, "These are your husband's lungs, and there's really no hope. It's just crumbling. There's 15% capacity in his lungs."
Love you.
After 3 days in intensive care, Pam had to make the heartbreaking decision to take her husband of 32 years off life support.
It's very sad, very lonely, and I miss him every day.
An autopsy was carried out to determine the cause of Peter Hansen's death, and 7:30 can reveal the findings. While there was some lung damage caused by cigarette smoking, the pathologist identified 3 key features consistent with EVALI. The cause of death was an acute lung injury and a probable case of EVALI.
I feel quite passionately that there was no other clear cause for his death, but I think our worry as a healthcare community is that 10 years from now we're going to see a lot more of this as it comes through.
Dr Sukhwinder Sohal researches the impact of vaping on lung health and is a board member of the Thoracic Society. He has reviewed the autopsy report for 7:30 and supports its findings.
There was evidence for toxic inhalation, which was related to vaping. Then there was pulmonary infiltration as well. They found significantly increased numbers of foamy macrophages or inflammatory cells. And there was a lot of fluid built up in the lung as well, which again indicates a strong EVALI case.
Gradually increase your vaping and try and reduce those cigarettes.
Dr. Colin Mendelsohn was involved in establishing the Australian Tobacco Harm Reduction Association, a charity that claims vaping is a less harmful alternative to smoking. The association received funding from vaping companies when it was first established, but he says it's since stopped. Colin Mendelsohn is sceptical of the autopsy's findings about whether Peter Hansen's death was a case of EVALI.
I think the explanation that we already have from the post-mortem of emphysema, fibrosis and respiratory failure is a very good fit with what we see with smokers. I think even if in the worst case scenario this was a case of EVALI, I think we need to keep it in perspective and look at the huge benefits to other smokers from vaping.
In the United States, more than 2,800 people were hospitalised or died during a worrying spike in EVALI cases about 2 years ago. Most of those cases were linked to vitamin E acetate and cannabis oils being added to vapes, and US authorities say there's not been a resurgence of cases since.
There's very good evidence now that was based on contamination of illicit cannabis oils with vitamin E acetate.
At this lab at the University of Wollongong, Dr. Jodie Morgan and her colleagues have tested ingredients in hundreds of vaping products.
Some of the things of concern that we have found is that the nicotine concentrations are very rarely the concentration that they say on the label. We also have found a number of products that contain some of the banned substances that are now banned from the TGA in Australia. And they include things like 2,3-pentane-dione, which is a butter-type flavouring, which has been associated with popcorn lung.
The managing director of Quit Clinics, Dr. Samuel Murray, declined to be interviewed about Peter Hansen. In a statement, Dr. Murray said vaping is not risk-free and more research was needed. In a separate statement, Liberty Flights said its products were screened and tested in accordance with requirements in the United Kingdom and had never contained vitamin E acetate. Pam Ashdown wants health authorities to review the current system of providing vaping products to patients. She believes her husband's death is a strong warning about the dangers of vaping.
It's just coming out now of how harmful it can be. So I think we just need to push and let people know that it can cause death as well.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.